Antibiotics are a tool used to care for and maintain cattle health. They're backed up by a stringent regulatory system and a strong scientific foundation. We continue our series of reports now with a look at the government's role in approving and monitoring the use of animal antibiotics in the United States. The Cattlemen reporter Dave Russell reports.
It's well known that in the cattle industry, producers work with their veterinarians to develop a holistic herd health program that helps their cattle maintain or regain superior health. Antibiotics are one of the many tools cattlemen use judiciously because they are effective in fighting pathogens that can cause illness in cattle. What is not so well known is the rigorous testing and approval process that must be adhered to before an antibiotic can be used in the beef cattle industry.
Within the Center of Veterinary Medicine, our main role is to do the evaluation of drug products that are going to be used in animals to ensure both their safety and effectiveness, and from that to protect animal health as well as human health. And we also take a look at any of the devices that will be used in animals as well. And this overview is one that has brought together a number of offices within our center and a talent pool that is similar to being in a university. We have absolutely the best minds here to do so many different reviews on the topics that we address.
Dr. Bernadette Dunham is a veterinarian, and she leads the U.S. Food and Drug Administration's Center for Veterinary Medicine. Her team at FDA manages the stringent scientific approval and monitoring process for the use of antibiotics in livestock, and they are responsible for regulating animal feed, including pet food.
You're looking at pharmacologists, our physiologists, molecular biologists, biochemists, statisticians. All of these experts are involved in the review of any single application that comes through CVM. And it's this team tagging with this detailed background of scientific rigor that allows us to be sure when we finally have an approval, it's met a very high standard for the science in order to assure the safety and effectiveness of that product.
The FDA review process includes testing all new animal drugs for safety and effectiveness in the animal, for sound and sterile manufacturing processes, and in the case of food animals such as beef cattle, to ensure food safety.
We also take a look at making sure that if there's going to be any residues of those products, they have to be reviewed by our Division of Animal Food Safety, and we also have to ensure that there is a residue test. So the company has to provide us with any of these tests, and we go through the analysis to ensure they work, so that if this product is going to be used, we ensure by the time it becomes a food item, there's no residues that could impact human health. So the scrutiny is not only to ensure the drug is safe and effective and does what it's supposed to do in the animal, but moreover, that anything that's going to come from that animal as a food product is going to be safe for human consumption.
Once a drug has FDA approval and is being used in the marketplace, the FDA's Office of Surveillance and Compliance monitors and gathers reports on the drug's use on an ongoing basis to ensure it remains safe and effective. Beyond FDA's testing and monitoring process, the USDA's Food Safety and Inspection Service also plays an essential role with regard to residue testing.
FSIS, our core mission, which we really got in this business back in 1906, our core mission is inspection. Inspection of livestock, carcass by carcass inspection in livestock. We look at every animal before slaughter. We make sure they're handled in a humane manner. We look at every carcass after slaughter. And then as they get fabricated throughout the food chain into either raw or ready-to-eat products, then we look at the various parts of those processes.
For FSIS, the primary focus in terms of antibiotics is to ensure there are no residues present in the meat.
We're confident saying the national domestic food supply, as far as a residue perspective, is quite safe. It's not perfect, but it's quite safe. The other antibiotic screening that we do is really focused on the in-plant arena. This is where my inspectors or veterinarians have a particular animal come through, and we'll talk about cattle, for example. If they have an animal come through with a particular disease and they think that animal was likely to have been treated recently with antibiotics, they're going to check that animal for antibiotic residues. Or if they have an animal that comes through and they see an injection lesion somewhere in the body, they're going to check that animal for antibiotic residues. And we do about 130,000 of those tests per year. So we do a lot of surveillance.
Another key piece of the puzzle in regulating the use of antibiotics in animal agriculture is a program called NARMS, the National Antibiotic Residue Monitoring System, which was launched in 1996. NARMS is a team effort between USDA, the Centers for Disease Control, and FDA.
So together what we wanted to look at was an integrated and a comprehensive program to try to tackle what might be happening with the antimicrobial resistance from essentially farm to fork and to consumer. And look at, one of the main goals is to look at what impact antimicrobial use in animal agriculture has on human health. And by no means is that an easy question to tackle. That's something that we've been working on for a long time now.
Cattle producers and their veterinarians take great care to use antibiotics judiciously. By law, they are required to follow the FDA-approved labels and are committed to the Beef Quality Assurance Producer Guidelines for judicious use of antimicrobials. They also support the NARMS program, which provides an early warning system to detect any change in pathogen resistance patterns.
Sometimes people talk about controlling antimicrobial resistance, and that's fine. We should always strive to have the most judicious antimicrobial use policy available so that we don't develop resistant bacteria. But what's really important is also to remember that we have to have management systems and we have to have processes in place that enables us to reduce pathogen level regardless of whether they're resistant bacteria or not, because they could still make us ill. And the whole goal of the Agricultural Research Service, particularly the food safety component, is to provide a safe and healthy food supply, a wholesome food supply for the U.S. So this is really what we're looking toward.
Clearly, for regulators and for cattlemen, healthy cattle are the foundation of a safe and wholesome food supply. It's also clear that the science behind antibiotics approved and used in the cattle industry can give consumers and cattlemen a high level of confidence in the way beef is produced.
Cattlemen are very conscientious about digging into the science. They're very curious about the science. As a matter of fact, I still go to some feed yards, and one of them I go work with. A big part of our day is sitting down around a table with the crew and the manager and what's new. And they're the happiest with a change in production when we've got science, when I can bring papers, when I can bring presentations and say this is what they found out and this is the reason we're going to do this. That's how cattlemen approach things.
I'm Dave Russell, reporting for NCBA's Cattlemen to Cattlemen.
There's a lot of science and information to take in when it comes to how the cattle industry uses tools like antibiotics. But there are threats that could prevent veterinarians and cattlemen from using antibiotics to prevent disease and keep cattle healthy. We'll have more on that coming up later in the show.